I'm the director of programs here at Water for Good. We're a nonprofit organization. Um, we currently work exclusively in the Central African Republic. We've been working there for 10 years doing community development work, providing water access through new well drilling, uh, pump rehabilitation. But we also have one of our programs is heavily focused on preventative maintenance and repair through a circuit rider program, which is actually what our project was on. It was focused on that piece of our business. Uh, Overall, we currently employ about 100 Central African staff, and then we have around 8 international staff who support either from the United States or from France. Just give you a little background on our history, we've drilled a total of 575 wells in the Central African Republic over that 10 years. We've rehabilitated around 800 additional ones. And currently within our network, we have nearly 1,000 hand pumps within that network, all rurally located. So. So just to give you a little context of sub-Saharan Africa, it's estimated by the Rural Water Supply Network that about 60% of pumps in sub-Saharan Africa are non-functional. There's been more optimistic estimates of 30 to 40%, but all in all, it's very poor results when you consider the billions of dollars of aid that have gone into sub-Saharan Africa and the water sector in the last 20 years or so. Uh, Water for Good, our kind of mission is to provide this hand pump maintenance services, which are preventative and affordable, and targeted for rural communities in the Central African Republic, which provides reliable water access as opposed to pump rehab models, which focus on repairing failed pumps. Our target is preventative maintenance to keep pumps from failing. Over the last 10 years, we've helped approximately 500,000 people with this service, which has created really great health and economic benefits for the communities. Uh, those benefits are higher than repair models that are episodic and really unreliable. So kind of a little overview of how our service works. We have circuit rider teams. Typically, a team is 2 guys, the head technician, and he has an aide who assists in driving and assists in the repair. And then there's oftentimes a reporter who travels with them. All of our reporting is done electronically now. We've been doing this for the last 2.5 years, doing electronic reporting, which has greatly improved our ability to have data management of the program and from the field. They use the iForm Builder platform with iPad or iPad Mini. We've done some surveys with communities to see what type of scheme they would prefer, whether it's pay for the materials and labor when your pump breaks, or pay a monthly contribution. And 98% of the communities we surveyed said they prefer like a regular monthly payment amount. A lot of that is due to the lack of banking infrastructure, the seasonality of the economics in the rural communities. They prefer to have a regular payment that they know what it is, as opposed to potentially large episodic payments. So it really functions as a pump insurance program at the community level. This is kind of just a photo that you can see on our website if you go to waterforgood.org and go to the maintenance page. You can see kind of a real-time functionality map of the region that we service. This is a network of 6 of the prefecture regions in the Central African Republic. They're currently targeted in areas where we've had like a strategic influence for a long time, and we've been able to continually access due to higher security in these regions. So if you look at the overall market, as we look at the country, our mission as an organization is to provide this service to the entire Central African Republic long term. Our current market size is estimated at 959 water points serving roughly 500,000 people. We figured that within these same regions we're currently operating, there's an additional 200 to 250 water points that we could pull into the program, which would be roughly 100 to 125,000 more people. If you look at the overall market of the Central African Republic, there's an estimated 2,000 to 3,000 additional water points, which would cover roughly 2.5 to 3.5 more people. And then there's the continual growth number of water points being implemented by organizations that ideally we would pull in these rural locations into the program as well. In terms of context of our operating environment, I think it's important to note that it's a very agriculturally based economy, one of the poorest countries on the planet. The infrastructure is extremely limited. There's basically 3 main roads that go out of the capital city that are paved. The rest are going to be very dirt-worn roads. A lot of potholes due to the transport of timber and things from the rainforest region, which is a big economic driver in the country. The locations we're working on are extreme remote rural locations. In fact, 54% of the locations that we work in don't even have access to just basic cell phone coverage, so we can't even make a cell phone call from those regions. And then it's also important to note the lack of supply chain infrastructure in the country. We're actually one of the only organizations who bring in Vernier pump parts, and Vernier is a French pump manufacturer that makes up about 2/3 of the rural hand pumps in the Central African Republic. It's also important to note the changing situation in the Central African Republic in the last year and a half. It entered into a civil war, and it's now a failed state. So we're having to shift from working in a poor, rural, remote country to now working in a conflict zone. So that's been a shift for us as well. But I do think it's worth noting over the last year and a half during this conflict, we've been able to keep mobilizing our teams, which are local, not as regularly or frequently as we would prefer, but in 2014, we've actually had a pump functionality statistic within our network of 92% functional. This is our value chain. Kind of the key things that we're looking at here are services, cash, information, and materials. You can see that from U.S. donors and partners that we have, they provide us funds to do operations. We provide them back information. If you look at suppliers, we provide them cash for materials. And in the interaction between communities with water pumps, we provide a service of water pump maintenance and repair. They provide us back information through surveys, discussions with them, and then they also provide back cash in the form of monthly contributions. And then if you look at the other people or organizations who interact with us on a value level, is the local water and sanitation cluster and local governments for the Central African Republic, and other nonprofits who are active in the Central African Republics. They can potentially provide us funding through grants or partnerships, and we're providing back information to the cluster level and local government level, and then also to those other organizations. And based on the information we provide to them, they potentially provide additional services to those communities in the form of medical, health, hygiene, nutrition, things like that. Look quickly over our cost profile. This is based on early budget for 2015. You'll see that about 50% of our budget goes directly to service costs, which is going to be broken up into the salary of technicians, materials, pump parts, fuel, and travel expenses. Then we have a service level overhead, which is going to be repairs to the vehicles, depreciation, things like that, cost of base camps, internet, utilities, tooling, reporting. and then we have organizational overhead that's allocated at a certain percentage against this program as we do other things in the Central African Republic, and that falls at about 21% of the total expense. In terms of revenue profile, this is our anticipated revenue profile for 2015. Only about 4% coming from community contributions, which is very low, and that is anticipated to be low due to economic disruptions from the Civil War in the country. Looking at about 33% coming from other nonprofit contracts, specifically for rehabilitation services, which these rehabilitation projects are going to be done by these same teams who do the maintenance and repair program. So we use that as a revenue channel for the overall maintenance program. And then there's also contributions which are going to be separate than contracted or earned revenue. This is going to come in the form of individual sponsors who sponsor this program on a monthly basis through our fundraising in the U.S. or institutional grant funding. Then you'll notice I have at the bottom of each of these is repair sales outside of maintenance program on the revenue, and then there's government subsidies. I actually have 3 different things that are listed as green. Those are our strategic targets for long-term sustainability of the program. That these are where the revenue needs to be coming from long-term in order to keep this program sustainable long-term. In terms of the unit economics, it's estimated from 2013 is roughly 96 cents per person per year to provide the service of reliable water access. And this table here is just kind of a breakdown of what the different percentages look like. It's estimated that at a community or a pump level, it's roughly $27.20 per month to keep a pump operational. And then in our fundraising method, we add a little bit in to cover marketing expenses and unforeseen expenses in the program. And then this is a photo from actually one of our teams, so all the electronic reporting that they do, it also includes, they take a photo at each visit of them working on the pump and a photo of the pump operational afterwards. And this is a really exciting picture for multiple reasons. One, you can see just how valuable it is to this community. If you look at all the different cans lined up there waiting for our service tech to finish the maintenance. This pump was functional when they arrived. They made a few replacements of small seals and things like that to make sure it's operating correctly. But this community actually is one that, even with the economic disruptions, they're contributing into the program on a financial level. So, management team. We have three high-level leaders within the organization that are based in Central African Republic. We don't have any expats who live in Central African Republic. All of the staff who lives in country is national Central African staff. And then all of these 5 operational managers work a portion of their time towards this maintenance program, with the exception of Ludovic, pictured second from the far right. He's 100% dedicated to the well maintenance program, managing, overseeing that program, and he's been in his position for just under a year. So it's been really exciting to have somebody dedicated full-time to this program. In terms of financial planning and scaling, from the U.S. side for fundraising, we've been marketing this last year a pump sponsorship, similar to like you'd see an orphan care sponsorship, where you sponsor at $40 a month and you get connected to a water point in the community that water point services. Each time we get a report back from the team on visiting that water point, whoever sponsors that water point will receive an emailed update with one of these reports, kind of highlighting, when the repair happened, information about the community and some photos of the visit. So we currently have 635 villages within our network that are waiting for sponsorship. For metrics, kind of some of our metrics that we'll be tracking the next year here. There's ones related to resources, which is going to be our annual operating budget. We're going to be tracking our year-to-year increase in earned income, specifically from those green points that I referenced in the revenue profile that we're hoping to see increases. And then we'll also be tracking the number of operational teams, which is currently at 4. As the program grows and develops, that will have to increase as well. In terms of activity, we'll be tracking actual pump visits, not just the number of pumps that we have in the network, but the number of pump visits as we target over an annual basis to visit each pump 3 times per year. We'll also be tracking community trainings, the pump parts used for repairs so that we can properly forecast like life cycle costs of these hand pumps. We'll be tracking in terms of outputs, the proportion of time that pumps on the network are functional each year, the number of community contracts that are signed each year. In terms of outcomes, we'll be wanting to track the cost per person per year to have reliable access. Ideally, we'll be seeing that number drop as we become more efficient in operations. And as the program grows, the overhead will be spread out across more pumps, lowering the cost per person and the cost per pump. And then we'll also be looking at average reduction in time spent in distance travel with fetching water, which will relate to some of the health and economic outcomes of the community through that reduced time spent fetching water. The key metric that we're tracking is the proportion of time that the pumps in the network are functional, and we're calculating that by looking at the number of weeks that are total non-operational in the water, total non-operational time of water points over the total number of weeks that it could be operational. So that's how we come up with the current number of 92%. So just in summary here, I know we're short on time here, but currently in 2014, we've reached 828 unique water points within the country. We've impacted roughly 500,000 people in one of the most unstable countries on the planet, and we've had a functional network time this year of 92%, and our anticipated budget for 2015 is currently at $326,424. So that is what I have for you, and thanks so much for just taking the time and any feedback you can offer on us. Let me know if you have any questions here.